on time. The Halacha discusses if a doctor assesses a woman's situation and she's very advanced pregnant, and for some reason or another, medical necessity, she needs to go through a C-section. And they're trying to schedule in when's the best time to do the C-section. She should not schedule the C-section to be done, of course not on Shabbat, and preferably it shouldn't be any day that's close to Shabbat, like Thursday or Friday. But rather, the best time to schedule is Sunday, Monday, Tuesday. And the reason is, even Wednesday is okay. The reason being because if you schedule on Thursday and Friday, then it could be that the procedure, even if it goes well, a lot of times a person after a surgery he's in the category of Holesh Yesh Bo Sakana, especially when there's a delivery, and therefore they need Hilul Shabbat. They need some violation of Shabbat for their health, for their safety. And therefore, it's much better to do it in the beginning of the week where it won't need, the first few days won't be in violation of Hilul Shabbat, as opposed to a Thursday or a Friday where it might end up turning into something that is required to be violating Shabbat. It's true you would be allowed to violate Shabbat, but why set yourself up in that situation where you're sort of forced into the position of violating Shabbat? So therefore, in the beginning of the week is much more preferable. At the end of the day, it's not always in the patient's hands. Sometimes the doctors are very busy and they say, look, everything in the beginning of the week is taken up, especially, if many Jews are doing the same thing. So the whole beginning week is taken up. And the only days that are available are Thursday and Friday. In Hanami, that's a different case, and therefore that has to be assessed in the particular circumstance. But initially, the scheduling should be done in the beginning of the week to avoid Chilul Shabbat. Baruch Adonai le'olam. Amen.